over to Scott and Scott.
Yeah, thank you, Amber. Thank you, everyone, for joining our webinar this morning. My name is Scott Sandberg, and with me is my colleague, Scott Hudnall. And we're going to discuss conducting a community needs assessment. And conducting a community needs assessment, in my opinion, there isn't one exact method of doing it. We've done 3 needs assessments for a community agency here in the Northwest Indiana area. And also way back, I did an epidemiology report for, collaborated on an epidemiology report for the city of East Chicago with a large not-for-profit over here who oversees many health services for the community residents. So those community needs assessments were very large and complex and sometimes frustrating, but I learned a lot about the community, and most of the resources that we used in providing data for this community needs assessment helped me learn a lot about the community in which we sit. And if I was working in a public library, I would definitely find that information to be very beneficial for many departments in my library, in my public library. And and it's very beneficial for an academic library as well. We were contracted out to do those community needs assessments, which means we were paid very little, but it was a very nice thing to do and for the community. And again, we learned from it. But that knowledge that I gained, or that we gained from doing these community needs assessments, that data could be used to help you improve in a public environment as well. And so conducting a community needs assessment, it sounds really complicated and frustrating and all sorts of things, complex, but and sometimes they are, depending on the size, but they're really nothing to be afraid of. And so again, thank you for joining our discussion this morning, and we'll proceed with the presentation. So, and I have a quote here, everyone. This is from the IMLS. Given the accelerating economic, social, and educational changes of the 21st century, today's libraries and museums face dramatic shifts in the populations they serve and the communities in which they operate. And this is very important to keep in mind. And many of you who work in the public library or in an academic library that is public as well can see the changes every day in your patronage. And so it's same for museums too. And you want to make sure that the needs that you already supply for your patronage are still relevant. And that's what a CNA is really all about when you think about it, is that you supply things to people. You give people, you fill a need for them being in the library, and you want to make sure that those needs are still being fulfilled and met. And we all work very hard in the libraries, and we have a large, diverse population, and they're becoming more diverse. So we've really got to keep our eye on the prize, which is continuing to supply the right needs to our communities. So this doing a community needs assessment can definitely benefit you in this respect. It's very important that we change and modify as our communities change and modify. Dr. Banda Ferraro de Santos, librarian, Forestry Information Center, Forestry Department in Italy, wrote an interesting article in 2009 on the origin of public libraries, providing information services to businesses. Santos writes, the public library historically has had 4 functions: informative, educational, recreational, and cultural. The public library's role in economic development played through its informative function is widely quoted by Anglo-Saxon writers, particularly North Americans. Its function as an information provider for businesses and industries shows great acceptance on behalf of information professionals as a means to justify their existence. And so this quote shows you that for many years, centuries, that libraries have provided information to the business community to help grow the community. So libraries, they were uh, educational, recreational, and cultural, but they were also considered informative. So it's important to keep in mind that we have many facets that we face every day when we are come to our jobs, and so it's this remains the case today in many communities throughout the United States. The business, the informative aspect of our profession, and it is an admirable position our public libraries are in. We're at a great advantage if you work in a public library to be so entwined with the business community and to have patrons that could be members of the Chamber of Commerce and so on and so forth that you could get great insight from and do great things for uh, to help uh, benefit the community. And those partnerships can go a long way and perhaps uh, when it's time for a millage, or if the library needs expansion, or if the library wants to add a branch or something like that. So these, if you look at it, a community needs assessment as a way to get you in the door of some of these decisions that are being made on the local level in your community. Again, those partnerships can go a long way and benefit you in the future when you want something from the community. You can show them that their needs are being met by doing a community needs assessment, and that you're willing to go the extra mile for uh, your patronage in whatever facet of whether it be informative, educational, recreational, or cultural. Let's see. Given the passion we librarians have for finding answers to humanity's questions, and our penchant to know a little bit about everything, it is no wonder the business community would find the public library a valuable ally in its never-ending quest to discover information about the community and to expand their businesses. Okay, let's see here. And Scott, would you like to add anything? Scott, nope.
So that part, not yet.
Okay. All right. Okay, so this next slide here, and you can see when you were little, scary words might have been dark, spooky spiders, monsters. Now that you are older and have a library job, scary words often include the terms community, statistics, demographics, partnerships, and the most dreaded of all, assessment. And so, yeah, it can be frightening at times if you're faced with well, we're all a little apprehensive when we're given a big project, and these are big projects. But of course, if you're focused and determined, you can learn many great things about your community by doing a community needs assessment. And if you flip a CNA around and you say assess the needs of the community, I think it's a little bit more appetizing because if you're assessing the needs, you're doing what your mission has always indicated that you were to do, which is to provide for the needs of the community through education, cultural programs, being informative, and so on and so forth. So you're doing that already every day. And when you ask questions, you're to a patron that you know at your desk, you're gathering information. You're doing a little community needs assessment right there because you're gathering feedback that's uh, qualitative and sometimes quantitative, and you're collecting numbers every day. You just maybe don't realize that it's not in a cohesive uh, like a CNA would be. But a community needs assessment, or CNA for short, is often associated with gathering information to formulate evidence-based solutions to health concerns impacting a particular community. Although they can be complex and time-consuming, a community needs assessment can be a valuable tool for a library to determine the needs of their community based on a particular subject with desired outcomes in a defined period of time. CNAs can be tailored to fit the needs of any organization in need of qualitative or quantitative data on any particular subject. This includes, of course, public libraries, whose mission is to gain a deeper understanding of the community it serves, including opinions and behaviors towards library services. And in my notes, I placed here the Oxford English Dictionary. The definition for the word assess is to evaluate a person or thing and to estimate the quality or value or extent of. and to judge it. And I think that of course, we should keep that in mind, that every day we're a work in progress, and sometimes we can spiffy things up a little bit by looking into it ourselves, and the services we provide, and actually touch base with the consumer, the patron, and find out if those needs are being met. So
I have a little bit to add to that. A lot of times when you get started on a CNA or something similar to CNA, you might be concerned about where do I start? You might think that you don't have enough information to start, but in reality, a lot of times you get the information that you need as you're doing the CNA. It's sort of like writing in its own way, where once you get started, you start to connect with people that can help you find information, or you find areas that you're lacking information that you need more information on. So the process is also where you learn a lot of information, not just before you even started.
the next slide here we have here. This is the E-Government Act of 2002, and the reason that I placed this slide in here is that it's never been easier to find the information for your community needs assessment than it is today. And many of you are aware we have the great Indiana State Library that oversees the dissemination of census. Katie Springer, who oversees the dissemination of the census information. The United States Census, American Factfinder in particular, is a fantastic tool if you want to really learn about your demographics of your community. And we'll get into that more later. But the E-Government Act of 2002 is basically, well, here it is, to enhance the management and promotion of electronic government services and processes by establishing a federal chief information officer within the Office of Management and Budget, and by establishing a broad framework of measures that require using internet-based information technology to enhance citizen access to government information and services, and for other purposes. And I include a link in one of the appendices that I sent to Amber, and you can see that here when you get the notes. But the E-Government Act has really been a great standard by which many states, including the state of Indiana, have used to make access to information, federal, state, and local, very, I don't want to say easy, but it's not as difficult as, and it gets easier every year. They're adding more and more. It's I can't imagine doing a community needs assessment without having electronic dissemination of those government records that you desperately need. I mean, it would just be a tremendous task. And so the E-Government Act is really important when you look at community needs assessments, because a lot of the information is right at your fingertips.
And sometimes when you're looking up information online, it's possible that the information has been posted online, but it hasn't been linked to yet. So sometimes, if you're familiar with URLs and how to work with URLs, which are used to get to web pages, sometimes you might have to tweak those to see the most recent data. Like they might be linking on the official page to 2014, but the URL says 2014, and if you change it to 2015, you'll see the 2015 data. They just haven't linked to it publicly yet. So keep that in mind too, sometimes when you're gathering data.
Yeah, that's a really good point. You're in control. And I know it's maybe hard to visualize what we're talking about here, but if you have a PDF, so say for example, they released some information. Well, what was our case with that? We had to find death or mortality rates, right, correct? And we had to find mortality rates, infant mortality rates in the state of Indiana for our region. And we, things are being released, as I mentioned, every day and every minute and every hour, perhaps. I don't know, maybe I'm taking it a little too far, but someone's dumping information, government information, at least monthly into databases, newly released. And so you can change the URL if in a PDF. If it says 14 and you're looking for maybe 16, put a 16 in there, because it's most likely that the only thing you need to change is the year, and you'll get the document even though it hasn't been disseminated. So that's a little trick that I learned from Scott and helped us greatly on finding the numbers we needed for our demographic build-up. So, okay, folks, let's see. Let's go on here. The Government Act. Let's see. So our next slide here. So when you're doing a community needs assessment, you want to know who, what, why, and when. Who are your learners? So who is your audience? What do they already know? What are their learning characteristics? What do they need or want to learn? Why and in what environment will they apply the project information, skills, or behaviors? So who is your audience? Well, that depends. In our case, our audience was large government agencies. We worked with, we worked with big organizations that needed this information, and our audience was them. We had to provide data on our community, on the Northwest Indiana community, for them, them being the United Way of Northwest Indiana. I'm sorry, not the United Way, but the Boys and or the Head Start organization, and the Early Head Start Expansion and Child Care Partnership Grant requires the applicant, and that applicant would have been the Head Start Agency of Northwest Indiana, to describe how it will maximize community impact by directing resources to the areas of greatest need. So basically, everyone, what we did here with our large CNAs is that we got data, and it was specific data for the Head Start agency, and to apply for monies, which they have to do every couple of years, to provide services to the communities in which their mission is to oversee. And every Head Start agency in the United States has to do a CNA. And we partnered with a business professor here at Indiana University Northwest, and we being my colleague Scott, I, and another colleague, and two more colleagues, to build these reports for them. So who was your audience? Our audience was those folks in Washington D.C. that passed out the money to these Head Start agencies who work very hard to make sure our children are met with the needs that they have. But what we had to do is we had to find out what those needs were presently, and we know what Head Start gives already and provides, but as in this, again, if we look back at our other screen, you'll notice that I said with the IMLS that given the accelerating economic, social, and educational changes of the 21st century, today's libraries and museums face dramatic shifts in the populations they serve and the communities in which they operate. And we work with a lot of kids, not here at the academic level, but at the public level, and families. And so if you look at the CNA that we did for the Head Start agency, and you place that in the respect of a public library organization, you could do the same thing there, and keep on top of how your community changes. So we had to prove to our audience that there was a greater need and that we needed more money, or we needed the Head Start agency needed to expand or possibly build a new area of which there was a need not being met. So every 2 years, the Head Start folks have to go through this, and we were fortunate enough to be part of that for 3 times, and we gained a lot of information, and we found out how to find it, and we now are showing you how you could possibly apply that to a public library setting, maybe, yes. Or you could do this in the academic too. So,
or at least the broad strokes of how to do one.
Right. Let's see. Okay. So let's go on to the next slide here. Thanks, Scott. What about the issue are you trying to impact with your project? So here, define the need for and the general aim or purpose of the project or activity. This is the overall goal for the project. So, for example, to support the mission of the Indiana Head Start Collaboration Office, that was our goal. To develop, finance, and compassionately administer programs to provide health care and other social services to Hoosiers in need, to enable them to achieve healthy, self-sufficient, and productive lives. So that was our goal, is to give the Head Start agency the factual data they need to expand their services to Hoosiers in need in our area. And you have a local Head Start agency in your areas around the state too, and or country, and they do these every 2 years. So I was thinking to myself that, boy, a public library could do a self-assessment, community needs assessment, or an academic or any agency really can do it. You could have a goal of health literacy, environmental literacy in your library. You could do uh, uh, just a number of things on your on a local level.
And when you're doing your projects, for any project really, there's this concept called mission creep where it's very easy to get lost in, okay, you found this number, I'm really curious about this number, oh, I'm curious about this. You're kind of moving the goalposts that way. So as you're doing your project, it's really important to keep what your purpose is in mind so that you don't stray too far from what you're trying to do.
Yeah, that's a really important point to keep in mind. It's when you're working with numbers, you can go beyond what you need. You don't want to make it any more complex than what it needs to be. It's already going to be complex, depending upon the facets that you want to facets of data of which you want to bring in. That would be, well, in our case, it would be, gosh, oh gosh, I've got a whole list of demographic data we had to bring in for these. But even if you're wanting to start a new reading program, or if you want to start an adult literacy program at the library, or if you want to do just any number of things, if you want to partner with businesses and so on and so forth, the demographic data is there and it's updated. And we got a new census coming up. We're going to have all new fresh data here very shortly. And with the Indiana State Library's great help in disseminating that information, you can get this information about your community and really expand your products and perhaps do a small project using a CNA. And there's many templates out there on how to do it. Like I said in the beginning of this presentation, I don't believe there's one exact way to get it done, but have fun doing it and learn about your community and learn about these various technologies that you can use electronically to get this information. So, okay. Thank you. What knowledge, skills, attitudes, or behaviors need to change? So here, determine what must be taught to satisfy the learner's needs. So what you have to do is you have to satisfy here, and this is something that is very interesting and can be very fun to do. You need to ask questions. You need to find out what your parameters are. You need to definitely have an idea of what type of data you want to pull in to make sure that you're getting the correct information you need in doing a needs assessment. What you have to really keep in mind is that the data can be complex and it can be oftentimes difficult to path your way to it, but what I do is I keep notes when I'm using American Factfinder or any of the other templates we've used and or portals we've used, and I keep track of things in a respect that I can find it very easily when I need to. So what we have to do is, oh, I'm sorry, Scott,
No.
did you want to say anything? Determine what must be taught to satisfy the learner's needs for our let's see, pardon me one moment. I got my notes mixed up here, everyone. Just one moment.
So we have to determine what information is needed by the organization that needs it. And sometimes the information that you need is buried within the information that you can find. So, for example, when you have the ages, like when you're looking for racial and ethnic composition of 3 to 4 year olds in Lake Porter County, sometimes you have to use multiple tables as an example to actually get the data you're looking for. In other cases, the information that you need might be broken down into two separate sections of the table, and you have to add that. Sometimes you even have to come up with a formula in order to calculate the numbers that you need based on multiple tables. So sometimes it's not just a cut and dry, this information is here, but sometimes it's that you need to figure out how to create the information from the information that's given.
And what also relates, thanks, Scott, and what also relates to what knowledge, skills, attitudes, or behaviors need to change to satisfy the learner's needs, you have to look at that as a way of mirroring yourself as well, or the agency that you work for. What knowledge, skills, attitudes, or behaviors do we have that perhaps could be modified or or uh, or elevated somewhat? And then we need to find out from our community whether or not our level of service to you or what we're supplying to you is the at the level at which they want it to be. So what knowledge, skills, attitudes, or behaviors need to change? Well, well, as Scott was mentioning, we had to supply this information to the Head Start agency so they could pass it on to the federal government, and we had to change their attitude that the money that the Head Start agency was allotted was not enough for the current needs, and and this is probably this slide is a little confusing, and there may be some questions out there. It's kind of hard to deliver this, and my notes weren't properly placed here. So if there's any questions on this aspect of the community needs assessment, please feel free to contact Scott or I, and we can sit down with you or anyone and help clarify this information. I made it a little bit more complex than what it needs to be, but change is good, and we see it every day in the library business, and we see people change, and so I embrace it. And, okay, I'm rambling on here. Let's go on to the next slide. How to best accomplish this? The best way to accomplish changing someone's behavior or attitudes, and this is definitely it's not as easy as what it sounds. But when you're working for a goal as important as funding an agency like Head Start or expanding a library, it's easy. I think people are on our side. Libraries are the greatest institutions in America, and we're very proud of them, and we're happy to work for them, and so on. But how do you best accomplish this? You accomplish finding all of this information for those learners that need to have their attitudes and behaviors or whatever context you're placing your CNE in, it needs to be changed. Well, you do that with numbers, and you do that with statistics, and you do that with visualization of those numbers and statistics and graphs and maps using GIS and so on and so forth. And this visualization and these resources can lead to you really swaying an audience. And numbers don't lie. I mean, I guess they can, but the government has a lot of numbers on all of us, and it's right at our fingertips. Scott, would you like to? Well, actually, here I go through for unemployment, for example, data for cities. You go through the Bureau of not labor studies, Bureau of Labor Statistics, the BLS, for unemployment data, and many of you know these things. For Indiana, Hoosier data, Stats Indiana. You can go to the BLS, the .gov for local area. Boy, what's it called? The Lauer data or Laos data. Anyway, local area
Unemployment statistics.
That's right. Okay, thanks, Scott. And yeah, some of these, I mean, you use the acronyms, and then when you have to state them out, it's kind of difficult to do. But for demographics, Stats Indiana, for the the FSS, Indiana has some of the finest. And I'll tell you, I've always been impressed. I live in Michigan, and Indiana state government really. And will you agree with me?
Yeah.
Yeah, it does a great job of getting the data out that is relevant to Hoosiers.
Yeah.
And that I hope everyone's using to to learn about the communities in which they live, because Indiana does a great job. Yeah,
It
go
does,
ahead,
very
Scott.
much so. There's even a site for Stats Indiana that you can find online. Another thing that we used quite a bit was American Fact Finder while we were doing this, which has a lot of tables, highly useful. Sometimes you have to go hunting for those tables, try multiple things, but there are plenty of tables. Another thing to keep in mind when you're doing these CNAs is it would be a good idea to create a document that's listing the information and where it's found and how. It's very useful because if you're doing another one of these CNAs again in the future, annually, every 5 years, whatever, then it makes finding that information again a lot easier. Whether it's to run a brand new CNA of the same type or a different type, whether it's to use updated information for a different CNA you're doing, or to demonstrate to someone the veracity of your sources. Like someone may come in and say, "Hey, where are you getting this number? How do I know that this is the real deal?" You can show, "Hey, this is where I got it from." Or many other needs. In addition, it can be very useful. Organizations have changeover where someone might retire or something might happen to them, or they might go to a new job. So having a document like this for someone that's coming after you is a very good idea. That way, there's some preparation in case something happens.
Yeah, and then to Scott's point on writing it down, keeping a log of where you find this information, it's important to have that at ready reference. For example, if you had someone come in that wanted to know, or a new family perhaps that came into town, or if you were looking to expand a collection in, oh gosh, or if you were looking to expand your collection in uh, another language. Okay, so, well, I've been seeing a lot of patrons come in that have a French accent or a Moroccan accent or well, Moroccan is French, or Arab, whatever. Just they're new to town, and there's many folks coming in that have this accent. I haven't had a chance to talk to them, but I want to see what's going on. American Fact Finder can provide that information for you, and you could expand a collection based on American Fact Finder's statistics. So, 5-year estimates, 4-year estimates. You can see what trends are taking place using census data. So again, the Indiana State Library is a great source for all that census data. American Fact Finder, of course, the ISL disseminates that information from the census. So, and it's good for businesses too. So if you are on the Chamber of Commerce in your community, or if your library is a member of the Chamber of Commerce, ours was. I worked in the public library before coming to IU, and I went to the Chamber of Commerce meetings, and I knew the numbers that some of these folks were looking for. Not all the time, every meeting, but if someone were to say, well, I wonder why CVS isn't really investing CVS in our area. Why is that? Well, it's all because of demographics. They don't find it beneficial to be there, or and you can find out. You can tell that business person, well, then maybe that's why you're not growing. Is certain demographics aren't here, but these demographics are here, and this may be a way for you to expand your business in lieu of CVS or something. But anyway, it's all based on numbers, so there shouldn't be any fear of them or statistics, because that's what drives the world, and that's what the government has. That's what a lot of these agencies have for you. They're doing their best to make sure that it's not complicated and easy to understand. But if you can start doing a little bit of this demographic search, this data search for yourself uh, on a particular project that you want to see come to a fruition, then like do a mini CNA and gather that information and open your eyes. It's really quite interesting.
And a site that's named something like American Fact Finder, for some people it might sound like it's very broad, like just the state or the whole country, but in reality it can go at least down to the different counties. Like in our case, it's Lake County, nearby is Porter County. It can go at least down to that.
Okay, so design and you may not. Let's see. Okay, design. So broadly outline the project. Determine how you will move the audience from the current situation to the desired one. So I can say here that so you want to increase your uh, nonfiction collect or your maybe your children's collection, or if you want to expand your um, library or gain a millage, what have you. Determine how you will move the audience from the current situation to the desired one. Well, in many cases, if you're, well, you could put this into many respects. You'd have to, oh gosh, well, so for example, if here you had a library board, if you're the director and you see every day that your library is cramped and needs to be enlarged, your audience would be to your audience would be the library board of trustees, and you would have to sway them that the numbers show that our library district's growing and that we need to have another wing put on the library. Well, that's a huge project, and not really. I mean, I guess you could look at it in any way. It could be as simple as going to your chair of your library board and saying, "Listen, I'm going to dig up some numbers that show we need our library larger." And
Which that's a good example of how, depending on the situation, the needs of the CNA can change, or where you get information from, who your audience is. That can be very different, which can lead to different approaches.
right, and you have to keep an open mind, and you have to just be yourself, and you're all information professionals, and you'll get the job done. Uh, but and the point of this presentation is to show that a community needs assessment need not be something to fear, and so it's just a fun thing to do. Let's see. So you could show them the board the numbers that show an increase in the population of your district, and then your audience would be to the commissioners of the village or the town where you work, I guess. Your mission would be to your audience then would be to your patronage. You would have the numbers. You'd have everything that shows that, yeah, we need money from the government, the state or the county government to broaden our horizons, our library imprint. So
I love the value of the design approach is this portion of it is that you can ensure that if you give the numbers and somebody says, okay, you have the numbers, what are we going to do about these numbers? What are we going to do with them? Having a plan in place, such as the activity milestones and resources needed to achieve something from those numbers, and having an evaluation plan for how that went, is part of convincing to actually go through with the project.
yeah, it's again, as long as you have a goal in mind, you can do a mini CNA, you can do a large CNA. We're all busy at work. If you got a partner, you can. Our CNAs for the Geminis Head Start Agency, those were, gosh, 5 months in the making. And that was a lot of work, and that was on top of what we were doing in the library too. So our other duties. So, uh, and then the visualizations and making the graphs and things can be time consuming. So, but definitely fun to do. We learn many things. Develop. Identify, select specific content. Identify and include appropriate materials, information, and activities in your CNA. So once you gather the numbers, what you want to do is you want to place them in what we did. We placed demographic information in maps. We placed them in graphs. We placed them in
Tables.
Excel spreadsheets, and a lot of the platforms that we used are available in the public library. The public library patron stations. We had the IU computers here, and so we just we put it all together in using the materials that we're all familiar with. How will you structure the content? Sequencing, presentation, and reinforcement of the content will rely on grouping of related objectives and activities. So, for example, in our CNA that I've listed up there, if I can find my copy of it, well, you can show that oh gosh, let's see. Excuse me, folks, I just dropped my sheet. I've got a folder. I think that's it. Yeah. Thanks for your patience. I just had to grab a folder here. So for our, we had to find, for structuring and so on and so forth, you guys, we had a place in per capita income, economic development for Northwest Indiana. We had to, and this was for our large CNA, we had to show how the economy was growing or not in this area, the steel industry and so on and so forth. So that was all part of our development stage. And again, if you can see in our supporting documents here for this presentation that the community needs assessment that we created was really complex in structuring and in reinforcement of the content, grouping of the data and the activities that we did. So select the appropriate delivery methods, lecture, group discussion, case studies, activities. There's different types here under the delivery methods. So how are you going to deliver your information on your community needs assessment to the audience? And again, it depends on the context in which you are working. Again, ours was our audience was the Head Start agency and the federal government. In the end, yours could be the library board first, an influential patron perhaps in the community, a business leader. It's completely variable upon the context in which you find yourself or and what you're doing your CNA for. So and then implement, identify appropriate audience and venue for a pilot of the project or activity that includes opportunities to receive participant feedback. So for example, Scott, you have?
Yeah. So when you're trying to get participant feedback, you want to be careful about making sure you don't end up tainting the data gathering method in some way, so that you try and avoid getting what you want to hear rather than what you need to hear. Very important distinction. One example of how you might accidentally taint feedback is by, if it's a survey, putting in leading questions. So an example of a leading question would be, how good was this workshop? You're kind of leading them toward the thought of good, as opposed to if you're trying to be more objective with it by using something such as, what was your impression of this workshop? That's just an example, and there are ways even of formatting a survey where you don't have questions like that at all, but more like, how do you rate this? So one way is avoiding leading questions. Another issue is if there's a lack of options for anonymity. That's another way of potentially tainting results, because some participants might be reluctant to share their true thoughts and feelings about the project, that they know other people might see what they thought. They might be worried about upsetting somebody or something along those lines. It could result in false answers or a lack of responses that involve important criticism as well. So that's another point, is omission of response can be just as bad as a response that is just giving you what you want to hear, because you're not getting the full view of what people are trying to say.
And again, this is all about assessing the needs that already exist and the goal of increasing those, the resources to meet those needs. So again, it's all about assessment, everyone. So if you have a project and you want to pilot it, you want to give the audience an opportunity to see what you have and what you're going for, and you want feedback from that. As Scott was mentioning, in focus groups, or if you're doing a survey, there are steps you can take to really protect that data and not sway. You don't want to lead someone into believing something. You want the facts to show that there's a definite need for the expansion of the library or the children's department, or of cultural activities or funding for the library in general. There's a need, and so you want to you want to show them the facts. You don't want to lead anybody in making your decision come to fruition or your project come to fruition. You want it all to be on the up and up.
And if what you get from the surveys says that what you thought was true turns out to not be true, you can take that as a sign that, okay, maybe there's something else that we could be doing that's actually more useful for our target.
And in the end, you want to develop the development criteria, use the results of the needs assessment and the instructional design process to implement the project. So once you've gathered all the data and you've presented the pilot to the folks, and again, it depending on the context in which you find it yourself, then uh, then uh, then you're good to go. So, uh, let's see, conduct data. I'm sorry, the next slide here. I'm looking at the clock here. Okay. Evaluate, conduct data analysis to focus on recommendations of community members that emerge from the questionnaire, focus groups, and community meetings you held as part of your community needs assessment or assessing the needs of the community. You could organize the qualitative data by key theme in 3 broad areas of focus. For example, in a library context, a public library context, current operations and strengths of the library, the ideal future of the library, or recommended improvements or enhancements to the library in order to meet community needs. So that's the most important thing. You want to make sure that the evaluation is thorough and it is something that is met your goal.
Yeah, and then the evaluate portion of this, if you're doing CNAs for this multiple years, like the next year or 5 years later for the same thing, evaluate will also help you to determine if there's other data that you weren't gathering before that you now need to start gathering.
Yeah, so that's on the 2-year cycle that we did with Geminis Head Start. So you can evaluate the numbers in a year or another year, and reevaluate and reevaluate and reevaluate, because that's how agencies grow, and that's how they receive funding. All this data too that you collect in your community needs assessment, the demographic data, the state data, that can be then put into a proposal. You can gain, funding from federal agencies, government agencies, state government agencies. Numbers really hit home. They show the need, and numbers don't lie, as I said. And if you can gather this every couple of years or so by doing a mini community needs assessment or assessing the needs of the community based on what you give them already, then you can gather. You can apply for LISTA funding. You can apply for MILS funding, ALA funding. You can put that all into a proposal with numbers, and they really like that because it's concise. Yeah. Let's see, everybody. I think we're winding down here on time. I think. Let's see. Some of the references we used in the presentation here are right here. 21st Century Skills. This is from 2009, and so on and so forth. Know Your Neighborhood. Community Disease Assessment Primer. This was in Library Journal, I believe. Anyway, very interesting article here, and it really you can relate to this article more so than perhaps you were able to relate to us during this presentation, because but it's a good article. That's a great article right there.
Yeah, like I personally find text a lot easier because then I can just read through it. Whereas if I'm listening to somebody, I might mishear them or I might miss a word that they said. So yeah, article, I suggest going to it.
And we do have a little bib here. There's some library outreach partnerships and distance education, reference librarians at the Gateway. Some further reading here on community engagement. So just really kind of a nice bit of reading there. And let's see. And there's our bio. So if you guys have any questions, or if anybody would like to ask us anything, please feel free now, and we can hopefully answer those questions for you.
Hi, I'm just gonna pipe in real quick. I'm pulling up the screen now. So for the file downloads, if anybody needs an LEU for today's training, all you have to do is select this document and then select download files. In addition, we've also uploaded the PowerPoint slides and then a few other associated handouts that Scott and Scott sent us for today's presentation. We're going to be leaving this window up until 11:15, so you have time to download everything. I apologize for interrupting. So Scott, please take it back over again.
Thanks, Amber. That's it for us.
Well, I would like to mention that Hobson Head Start Assessments (1), that is just what we use to keep our documents in order, like what documents we're getting from where and how. That's an example of how you could create a similar document for the future. And that was a huge help for us because if we didn't have a document like that, in a lot of cases, we would have just been going through these and wasting a lot of time, and just it was a huge help. So if anyone has any questions, please ask. Feel free.
Okay, so if there aren't any questions, I guess that'll be it for today. It looks like nobody has any questions. Maybe you guys just did a phenomenally good, comprehensive job. Well,
thanks to everybody that came.
and thank you too for agreeing to do this presentation. I really enjoyed it, and the slides were incredibly dynamic, and so was the content. All right, and just a reminder again, we are going to leave the file share window up, so you don't have to do a quick rush to download everything. It will be up until 11:15. And thank you everyone for attending today.